Today I'd like to do an update on a series I have done earlier about the disparities in healthcare. One of the concerns that has arisen out of the pandemic is that there seem to be these disparities in terms of different ethnic groups and the healthcare services that they have been receiving. Part of this discussion goes to the whole concept that is debated back and forth in society today about, is there a systemic type of racism? Many people will say, this racism really isn't systemic. It's just something that occurs in individuals. It's got to be addressed in individuals. Others will argue that no, there are certain systems that we have that really are kind of oppressive to certain groups and have been consistently so. The systems that are generally spoken of are the healthcare system, which we'll speak about a little bit in this video. And also people mention the educational system, the prison system, those types of systems, the housing system. That there are disparities, the employment system. These systems tend to have consistent outcomes that show large gaps between those who are white and those who are black, Hispanic, and other minorities. And they seem to consistently show that, which would be an argument that maybe there is systemic racism. So it's something that you have to look at, evaluate, and judge for yourself if you think there is a systemic racism or if you think it's just an occasional thing that happens between people. But in terms of disparities in healthcare, the CEO of Northwell Health on Long Island, Michael Dowling, has spoken to this issue of the disparities. Northwell Health is really a large institution, 14 billion in revenue, 22 hospitals, 830 outpatient facilities, 77,000 employees, and on Long Island there's 38,800. So it's a large organization, and so it can give us a little glimpse into maybe a little bit about these disparities and how they possibly can be addressed. Hundreds of millions are spent in taking care of the uninsured or the underinsured. So where this issue would come up is there are a large number of people, obviously, who don't have health care insurance, or their health care insurance does not meet the expenses that are needed to take care of them. And this is a large issue. It's been addressed somewhat by the Affordable Care Act, but it still doesn't cover certainly everyone. And so it is a concern. Their mission, of course, though, is as a hospital, is in a healthcare facilities, is to try to provide in some way for everyone. You don't want to turn someone away who is having a healthcare crisis, obviously. He reveals in his discussion about healthcare that mental health care is not a moneymaker for their system. We frequently speak about this, about the need for better mental health care services, and you wonder why. Of course, it is an issue. The issue is really an economic one. It's difficult to make money in this field. Expenses are high, income is low, so it's an ongoing concern. And how do you address that? Where do you make up for that difference in terms of maybe services that are needed, but how economically can you provide for them? So it's an ongoing issue that we certainly struggle with in our society today. And Michael Dowling gives us a good glimpse into this because he is such a large healthcare system with so many patients that come, to address those mental health care needs. Difficult if it's not economically feasible to do so, obviously. Some parts of the healthcare system actually make money, and some parts lose money. So naturally, what they try to do is this cross subsidiation, where the subsidizing of one area helps with another area where there is a deficiency. Um, in many areas where there are equity issues, Dowling notes the providers are paid by Medicaid, and Medicaid is a service that is given to those who are somewhat economically disadvantaged, who don't make sufficient income to buy healthcare insurance. And so that is the area that where you see a lot of equity issues. So that area might be more represented by those from minority groups, and so there are significant issues there, obviously. The difficulty is Medicaid does not pay enough for you to cover the costs of the patient and the cost of the treatment. So because of that, you're going to run a deficit. Also, the reimbursement from Medicaid takes time, and you become then an advocate. How do you influence the reimbursement system to make up for that time gap? Because obviously you've got to pay your employees. You can't say to them, well, we didn't get our reimbursement from Medicaid. We're not going to get it for another 3, 4, 5, 6 months. Can you wait to get your pay until we get our reimbursement? Obviously, you can see the problem that that's going to create for somebody who's trying to provide these healthcare services. So what we see here is really the systemic issue of the Medicaid problem, the lack of profit in terms of mental health care services, and the number of those from certain ethnic groups who are in the Medicaid situation, and therefore the difficulty of providing adequate healthcare services for these. And that would be, again, part of the discussion of these disparities that occur in healthcare. I think this is a good insight into the practicality of this in terms of the economics of the system.